In an election campaign, the local government promises to improve its hospital services. As an officer working for the Health Ministry, Mr. Dean is put in charge of meeting with the local hospital representatives to discuss the matter and find a roadmap to implement the improvement. Unfortunately, most of the top managers of the hospitals in the region have other administrative tasks. How can Mr. Dean trigger his work? Mr. Dean decides to appoint a hospital service improvement committee. After a first kick-off meeting, the committee immediately calls for tenders in order to get support in defining the process. IT consultancy companies specialized in hospital solutions come over to the meeting. Academics from universities around the country also come over, but none of the parties offer a satisfactory solution. As a result, Mr. Dean chooses the IT consultancy company which demonstrates the most satisfactory domain knowledge in order to set up an iterative process leading to the implementation. This iterative process involves internal representatives from the hospitals and consultants to coach and tailor their findings. Mr. Dean's committee pays a handsome sum of money to keep the evaluation going for a few months, and then the service simply stops. The entire process is too costly, an iteration does not bring enough added value, and it cannot be sustained very long. With Exo-brain, the entire process changes. Exo-brain allows any hospital to participate freely and willingly without any pressure or commitment. Its product, Health.Exo-brain, offers to hospitals to analyze their data in order to report to the top management the improvement opportunities and indications on where to optimize reductions and cuts. Because Exo-brain is user-friendly, clinicians and researchers from all over the country upload and store new data constantly. With Exo-brain, Mr. Dean would not need to hire an expensive IT consultancy company to carry out the service improvement task. Instead, Mr. Dean explains his motivation to Exo-brain, and using the data already available across the country, the platform can perform the analytics. The system can objectively measure the performance of each hospital and each point in time. The university academics extend their expertise by informing the developer team in Exo-brain to implement some novel analytics. As a consequence, Mr. Dean does not need to spend an arm and a leg to carry out his quality improvement initiative, and the entire process becomes sustainable. The resulting information about the quality level of the health service in the country is published quarterly. And Mr. Dean stresses the fact that, instead of competing against each other, hospitals tend to benefit from the collective improvement.